From the Pep Radio Newsroom, these are the stories we are covering at this hour. Transgender students from kindergarten through college at Ohio public and private schools will be banned from using multi-person bathrooms that fit their gender identity under a measure signed by Republican Governor Mike DeWine. DeWine signed the law over the objection of Democrats, teachers' unions, and civil rights groups, which had hoped that his objections to a ban on gender-affirming care for minors last year would carry through and prompt another veto. The bill takes effect in 90 days, and the governor lacks a spine and as a result didn't issue a statement regarding the signing. The Republican-backed measure, labeled the Protect All Students Act, requires public and private schools, colleges, and universities to designate separate bathrooms, locker rooms, and overnight accommodations for the exclusive use of either males and females based on one's gender assigned at or near birth in school buildings and other facilities used for school-sponsored events. It contains no enforcement mechanism. The ACLU of Ohio is among the groups that had lobbied for a veto, condemning the measure as a violation of the right of privacy of LGBTQ plus Ohioans that will make them less safe. School employees, emergency situations, and people assisting young children or someone with a disability are exempted from the restrictions, and schools can still offer single-use or family bathrooms. With DeWine's signature, Ohio adds to the pushback that's cropped up nationally among many Republican politicians, including President-elect Donald Trump, as transgender people have gained more visibility and acceptance on some fronts in recent years. 26 states have now adopted laws restarting or banning gender-affirming care for transgender minors. The U.S. Supreme Court is scheduled to hear arguments December 4th on whether Tennessee's ban on such treatments can continue to be enforced. Any ruling is likely to impact policies in other states, too. In other words, Ohio felt threatened by southern states about being the most bigoted and transphobic state in the entire nation and had to act fast so they wouldn't lose the title. Way to go, Ohio. Way to go. You deserve to be blacklisted by the entire LGBTQ plus community. For a bit of good news today, we turn to, of all places, Uganda. Last week, the Ugandan High Court of the Civil Division awarded $40,000, the equivalent of 150 million Ugandan shillings, to 20 men who were tortured by police after their 2020 arrests for alleged homosexuality. They assert that on the morning of the said date, their residence was invaded by a mob, among which were the respondents that subjected them to all manner of torture because they were practicing homosexuality, Justice Douglas Singiza reportedly stated. The alleged actions of torture include beating, hitting, burning, using a hot piece of firewood, undressing, tying, biting, conducting an anal examination, and inflicting other forms of physical, mental, and psychological violence based on the suspicion that they are homosexuals, an allegation they deny. The torture occurred in the village of Nkokonjuru in the Kiangera Town Council, Wakiso District. The plaintiffs worked with the Human Rights Awareness and Promotion Forum, a nonprofit human rights organization. They filed a human rights complaint against the Kiangera Town Council, Mayor Abdul Kiyimba, Principal Officer Philemon Wanayala, and the Attorney General. The arrests happened just after the Ugandan government implemented COVID-19 lockdowns. Based on the same suspicion of homosexuality, the applicants were then arrested, taken to Nkonkonjiro B police station, and charged with doing a negligent act likely to spread infection by disease, said Singiza. He noted that there was little evidence given for violation of the country's anti-homosexuality laws and that the investigations lacked merit. The men were then sent to prison on March 31st, 2020, where they were again allegedly beaten, examined, harassed, and subjected to discrimination. Uganda has strict laws against homosexuality. The 2023 Anti-Homosexuality Act, signed by Ugandan President Yoweri Museveni in May 2023, makes what it describes as aggravated homosexuality, including same-sex acts that transmit HIV, punishable by the death penalty, imposes a life sentence for recruitment, promotion, and funding of same-sex activities, even though it doesn't define what those are, and even bans identifying as LGBTQ+ in Uganda. roundly one of the worst countries in the world to have to suffer through. It has been roundly condemned by human rights organizations, members of the U.S. House of Representatives, President Joe Biden, and even Pope Francis. You know, if you've alienated the Pope, you're probably doing something wrong. Dr. Frank Mugisha, a human rights activist and executive director of Sexual Minorities Uganda, said on X of the ruling, a Ugandan court has awarded 150 million shillings to 20 Ugandans who were tortured for alleged homosexuality during the COVID lockdown, marking a significant victory for the LGBTQ+ community. This decision builds on earlier successes, including a 2008 ruling for Victor Mukisa and a favorable judgment against Rolling Stone, a Ugandan tabloid known for its harmful publications. So then, what will medical care be like in the United States for the LGBTQ+ community in the coming years? With President-elect Donald Trump just under 2 months away from taking office and a slew of troubling cabinet appointments making headlines, including anti-vax crank Robert F. Kennedy Jr. for Health and Human Services Secretary, LGBTQ+ Americans are understandably concerned about what a second Trump administration will mean for our rights and healthcare. In a recent interview with the Washington Blade, Human Rights Campaign Director of HIV and Health Equity, Torrian Baskerville, acknowledged the fears many LGBTQ+ people, particularly those who are Black, trans, and or living with HIV, are experiencing around healthcare in light of both Trump's rhetoric and the proposals laid out in Project 2025. While we are desiring and hoping for the best, he said, the reality is that things that we have seen, at least the rhetoric, hasn't been hopeful. And so we're just hoping that there are guardrails in place to help maintain and control as best as possible some of the things that may be going on. Speaking prior to Trump's announcement of Kennedy as his pick for HHS Secretary and of Marty Makary and former Representative Dave Weldon to lead the Food and Drug Administration and the Centers for Disease Control and Prevention, respectively, HRC Senior Public Policy Advocate Matthew Rose weighed in on the importance of the incoming president's choices for those positions. HHS will be very important for us, Rose told The Blade. Who they put at the Office of Civil Rights at HHS will be incredibly important for us. The Assistant Secretary for Health has, under Democratic administrations and in Republican administrations, been a champion for us sometimes. Admiral Brett Giroir, Trump's Assistant Secretary for Health during his first administration, Rose noted, did what he could for us. While Rose said he's less concerned with Trump's pick to lead the National Institutes of Health, unless they find someone who's really batshit crazy, and they're likely to, he said the FDA appointment is a worry because it could change just how we view drugs and drug regulations and how those get approved. Trump's pick for director of the Office of Management and Budget is also a concern, Rose said, because the people who make the budget decide how money gets spent. On Monday, Trump nominated Russell Vought, described as a key architect of Project 2025, for his OMB director. In a recent interview with Democracy Now!, ProPublica reporter Molly Redden indicated that Vought is likely to use the position to block funding for programs and organizations like Planned Parenthood that don't align with Project 2025's radical right-wing agenda. To read more about the stories that we have shared today, go to the Pennsylvania Equality Project website, paequality.com, and click on the radio tower to go to the PEP radio page. Be sure to download the Live 365 app to take PEP Radio wherever you go. And that's the news at this hour. Now back to more music on PEP Radio.